Hi, this is Winnie Anderson. I'm here today with my physical therapist, Dr. Patricia Repici, who's currently practicing in Woodbine, New Jersey. And Trish has agreed to let me pick her brain today and ask her lots of questions about all things relating to physical therapy, fighting aging, how we can get more mobility. So I'm going to go ahead and pick her brain today. So Trish, the first question that I'd love to ask you has to do with the fact that you are a non-participating physical therapist, meaning that you don't participate in insurance. You don't take insurance from your patients. Can you talk about what made you decide to do that?
Okay. First of all, insurance companies restrict the way physical therapists practice. The first thing that you have to do is you have to certify or pre-authorize the part and the problem so that the insurance company can decide whether the problem is severe enough to warrant or deserve treatment. They then decide on a list of things that you're allowed to do, procedures and treatments that are allowable for the condition. They also restrict how much time that you spend with the patient. They restrict the frequency with which you see the patient and the number of visits that you're allowed to have. So basically, say for a condition, you're allowed to do this, this, and this 3 times a week for 2 weeks, and then the patient needs to be better. I've even had patients who, because of their work schedule or their family obligations, only able to come in like once a week. And I've had denials from insurance company with them saying, if they can only come once a week, then it must not be that bad, so no, they can't have treatment. So long story short, and I did participate for a long time, I frequently felt that what the patient needed wasn't always what was allowed. And so I made the decision to become a non-participating provider.
Okay. Wow. Yeah, you get the feeling, and I've certainly been a patient on the other end, where you get the feeling that the insurance company is trying to dictate your treatment as opposed to the healthcare specialist who is educated and is really the professional in this case. So there are certainly advantages on both sides of the coin, right? Advantages to you as the healthcare provider.
Right.
What are some of the additional advantages, though, really for the patient in working with a provider who does not participate in insurance?
Well, there are a lot of advantages, and I think it becomes worth it to the patient. First of all, they decide when they need treatment, and then they can access a physical therapist at any time. There's no need for paperwork or referral or permission from your doctor. You decide you want to go and you can go. The physical therapist can then evaluate the patient and do what they feel is needed and not have to worry about what's allowed. I get to spend, an hour with the patient, which I think is what the patient needs, not a, finite period of time. There is a frequency that's determined by, mutual agreement between the physical therapist and the patient. The patient only wants to come once a week. That's fine because I give the patient a lot to do at home. My goal is to get the patient eventually self-reliant and independent, not dependent on me for visits. So it's good to start off right away with the assignment. And I'm available to the patient anytime between visits, by phone or by email. So if I give the patient something to do and they have a problem, they can call me and we can work it out over the phone between their visits. So the frequency of once a week works out, really well. And, they're better in the number of visits that it takes to get better and the time that it takes to get better. So, if you have to miss a week with insurance-based coverage, you miss a week of your covered period, and it's gone. So unfortunately, things get in the way, and this way the healing and the recovery gets to take as long as it needs to take.
Yeah, I can attest, my husband is a patient as well, and he said it was the most cost-effective treatment he has ever paid for and worth every penny. So we can both really attest to that.
And people have told me they get more out of one visit then they get 3 visits elsewhere.
Right. Okay, great, great. Thanks. So this has been Winnie Anderson with Dr. Patricia Repici of Woodbine, physical therapist. And if you would like to get more information about physical therapy and how it can contribute to your health and how you can restore mobility, fight aging, you want to visit restoremobilitynow.com, where you can get an additional video that Trish has for you, along with some other additional information. Thanks very much.